Dr. Neha Gupta, Senior Infectious Diseases Physician, and today we are going to discuss regarding HIV and sexually transmitted diseases. So what is HIV and how is it different from AIDS? As we all know, HIV is a retrovirus which is a sexually transmitted disease, and the majority of transmission is because of the sexual transmission, but it can also happen because of sharing of the needles as well as from an infected mother to the baby. HIV infection can have various spectrum of presentation. So it can be asymptomatic, it can present as an acute HIV infection where the patient can have some kind of fever, there can be sore throat which can be present, and sometimes there can be a flu-like symptom. So it can, when infection happens, some people may have some acute viral-like syndrome, and this could be one of the first manifestations of HIV. However, when the treatment is not given, it can progress and result in AIDS. What is AIDS? AIDS is one of the late stages of HIV infection where the CD4 count is less than 200, or the person who is living with HIV is having a particular AIDS defining illness like esophageal candidiasis, or it can be a severe opportunistic infection like brain infection with the fungus Cryptococcus, which is Cryptococcus meningoencephalitis. Sometimes patients can also have CMV infection or other severe AIDS defining illness. So when we talk about what are the symptoms of HIV, it can be broadly classified as somebody who is completely asymptomatic. So there are no symptoms, people are living with it but they don't have any symptoms, and at a very late stage they may present. Sometimes it can present early with some kind of like weight loss, there can be fever, there can be diarrhea, and at times there can also be zoster, which is herpes infection affecting the body, and it can also be in multiple dermatomes. There can be oral candidiasis, that is fungal infection of the mouth, sometimes ulcers, which can also be one of the presentations. And as I just mentioned, it can present very late with some severe opportunistic infections. So how do we diagnose HIV? So HIV infection, now we have effective strategies for diagnosing it, and one of the main strategies for diagnosing HIV infection is ELISA method. That is, it's a blood test which is performed, and it is HIV ELISA which can detect both HIV-1 as well as HIV-2. Earlier we were using Western blot assays as well for the confirmation of HIV. Currently available HIV tests, which includes HIV ELISA, are very effective and have a window period of just 15 days. The test is positive and it is performed with multiple tests, then it is very likely that the specificity is very good and we can detect the HIV infection with this. How do we treat HIV? So in the last 40 years, since the detection of first AIDS patient in 1981, there has been staggering advances in the field of HIV medicine, and there has been many effective medications which have arrived. So currently still HIV cannot be cured. However, we have medications which can effectively suppress the virus, and if the person is with HIV infection is taking these antiretroviral drugs regularly with full adherence, they can lead a life like a person who does not have HIV. So with the effective medications, with regular monitoring, it is possible to lead a good and healthy life. And of course, we have to be very careful about our sexual behavior as well. It's very important to follow the safe sexual practices, take regular vaccinations which can prevent the HIV infection, and of course follow a healthy lifestyle. If there is any query regarding this, please contact us. Thank you so much.